Have you ever been bothered by the appearance of your eyebrows? You feel like they're hanging low, or you have a lot of overhang here, or maybe you had a previous upper blepharoplasty, but your eyes didn't open up the way that you wanted. You may have looked into brow lift surgery, but you're concerned about how you'll look afterwards. I know personally, a lot of my patients are concerned that they're going to look surprised or have really unnatural looking arched brows. Hi, I'm board certified facial plastic surgeon, Dr. Delaney, and I'd like to go over a case study with you to give you an idea of what we think about when we recommend a brow lift and also what a temporal brow lift specifically looks like. So we have an example here of a patient who wanted to improve the appearance of her brows. Whenever somebody comes in to discuss their eyelids, I look at their upper eyelids, but I also look at their eyebrow and their eyebrow position. Ideally, in women, the eyebrows are at the level of the eye socket or a little bit above. When they drift below, that's when they start to look a little bit heavy and you may look a little bit concerned or tired. All right, so in this patient, we could see her eye socket is about here. And so on the inside, the eyebrows aren't too bad, but on the outside, they're starting to get a little bit lower. She's on the younger side, so it's natural. Usually the outside part of the eyebrows will tend to come down faster over time. Next, let's take a look at the anatomy of the area. When I think about the eyebrows, I think about which muscles lift the eyebrows and which muscles pull down the eyebrows. The only muscle that pulls up on the eyebrows is the frontalis muscle, and it's the muscle that is responsible for creating these horizontal lines. So that is the only muscle that will help us lift the eyebrows. Now there's multiple muscles that will help pull down on the eyebrows, your superciliary corrugators, your procerus, and even your orbicularis oculi muscle all contribute to pulling down on the forehead and the eyebrows. Naturally, you could see how over time, with repetitive downward movement and gravity, eventually the downward action of the muscles and gravity overcomes the upward motion of the forehead. Additionally, the frontalis muscle typically ends around here on the sides where we have what's called the superior temporal line. So that means that on the outside of the eyebrows here and here, there's no upward movement. So these areas, the outside part of the eyebrows, or what we call the temporal portion of the eyebrows, tend to come down faster. So that's usually why we see aging changes on the outsides of the brows first. Therefore, for younger patients where their medial or inside brows haven't really had a chance to age that much, but they're already starting to see signs of aging out here, we're talking about patients beginning maybe in their late 30s through their 50s, a temporal brow lift, or a lift primarily focused out here, is sometimes all they need. Now let me explain to you how a temporal brow lift is performed. So a temporal brow lift is typically performed using one incision on each side, and we hide them in the hair. So the incision will typically look something like that. Okay, we go far back enough where we can hide it into the hair. This way, when the incision heals up and the hair grows back through it, be nice and hidden. A lot of our patients are concerned about looking overly pulled or looking unnatural, and unfortunately that is a thing of the past. In the past, surgeons used to make big incisions across the forehead up here called a coronal brow lift. They would pull everything back and then remove a big sliver of scalp. And while that was effective in lifting the brows, it was maybe a little bit over effective, and I think it left a lot of patients with unnatural appearance. And there was a lot of tension, and there was problems with the incisions too. So what's different about the temporal brow lift that we perform today than compared to surgeries of the past is more about release of these adhesions to allow the tissue to reset to a more youthful position than pulling hard or using a lot of tension. So areas where we release, we're going to release along that superior temporal line, which I just mentioned before. So this is a dense attachment that attaches the forehead to the skin. We then make sure we release under the brow. We release what's called the arcus marginalis. So this is where the periosteum attaches around the orbital rim. Once we're happy that we've got release and we've elevated the forehead all the way across, we elevate posteriorly all the way back here to the occipital area, the parietal areas. This way it will accommodate the scalp to shift back without us having to excise any skin or tissue. We then will fixate the forehead skin posteriorly, either here onto the covering of the temporalis muscle or into the skull where we make tiny little bone channels. So we use absorbable sutures that temporarily help hold everything in place while everything heals up. But the key portion to this procedure is the release rather than tension or pull. So let's go into some example photos of this lovely patient. So this patient is seen here about 6 months after her surgery, and we could see the eyebrows just have a more relaxed, just more refreshed appearance. It's not overly arched, it's not exaggerated, it's very natural, and what we're seeing here is really primarily lifts up in those areas. Now you also see a little improvement in some of the 11 lines. So even though this surgery is mainly targeting the temporal areas or the outside areas, the forehead ages down and in here. So with the surgery, we're pulling up and out, and that'll help open up the medial brows without pulling the medial brows up unnaturally, making people look concerned. And in this lovely patient, we did not do anything to her upper eyelids. All the improvement that you see here is purely from the brow lift alone. So here's a different view from the side, and you could see, if we look at where the eyebrows are relative to the eyelid, you can see we have a little more natural curvature, whereas here this is kind of more like that. And we can see a little bit more of her upper eyelid. The incision has had a chance to heal up nicely, unnoticeable because it's all hidden in the hair. Additionally, if you're considering having a facelift at the same time, a brow lift will also help us redistribute some of the skin that can bunch up. If you have a lot of loose skin here, you're going to have some pleating up here, and brow lift helps us unfurl that skin further so you can have a nice flat result when we're moving a lot of the tissue up here. So there you have it. Here's an example of a patient who underwent a temporal brow lift. Some surgeons are starting to call it more of a brow reset, brow recontouring, because it's really not the same as the brow lift or the coronal brow lifts of days past. So we have a much more subtle, much more undetectable surgical result now. And you know, if you have any concerns about the appearance of your brow lift results, be sure to ask your surgeon about how they perform the surgery and look for before and afters for examples.